Hello, everybody, and welcome back to another episode of the show. Today, my guest is Christine Elliott, the Deputy Premier and Minister of Health here in Ontario. Hello, Christine, and thanks so much for joining me today.
Hello, Wyatt. It's a pleasure. Thank you.
So, before we dive into some of the COVID numbers and COVID events happening here, I'm just going to ask you a simple question of why did you get involved in politics and why did it interest you?
Well, I got involved because I was really interested in things that were happening in my community. I was on the board of a community mental health agency and a children's treatment center and a hospital board where we were raising money for to buy products for hospitals. So I was just interested in that, and I saw some gaps, and I thought that I wanted to be involved in finding some of the solutions. And so that's why I stepped up to run for the nomination and why I'm still there.
Okay, and so the next question that I have for you today is the fourth wave of COVID-19 is something that many experts fear, and according to some health experts is already here. So if cases reach the same levels as they have been in the past, let's say in January, February, or March, is another lockdown something that could be possible?
Well, I would say, first of all, we're working very hard to ensure that we don't have a fourth wave of COVID. I know that many people have had to give up a lot in terms of not seeing friends and family, and our frontline healthcare workers have been under tremendous strain. And of course, a lot of businesses have suffered too. So we're working really hard to make sure that we take every action that we can to prevent the fourth wave. But of course, the most important action that can be taken is for more people to be vaccinated. And so we're really encouraging everyone from age 12 up to please receive both doses of the vaccine. That will protect our healthcare system, but most importantly, it's going to save lives. And so that's what we're working on very hard today, is to try and get more people vaccinated.
Okay, and so you just mentioned about young people being vaccinated, and so people are kind of saying now that there's a pandemic of the unvaccinated, and so children ages 12 to 17 are the youngest demographic that have yet to be vaccinated. So why would you encourage people of that age demographic to get vaccinated?
Well, we know that we have over 81% of the entire population, age 12 and over, have received the first dose, but the rates between young people age 12 to 17 is only 68%. So there's still a lot more work that we need to do to get young people vaccinated. And of course, we want to do that before this school year starts so that everyone will be able to go back to school and not have their schooling interrupted. So we're doing a lot of work with schools, with families. We have some town halls where people can call in and ask questions if they're not sure about what to do. And we certainly encourage all young people, age 12 to 17, to discuss it with their families to make a determination about whether it's right for them. Some people have health conditions, of course, pre-existing health conditions that will make it difficult for them to be vaccinated. But for most people, I think it's just a question of answering the issues that they raise, and hopefully people will go out and get vaccinated. That's our best defense against a fourth wave, and also for a successful school year for everyone.
Okay, and we obviously still see some vaccine hesitancy of people. One major thing is obviously people preferring to take one vaccine over the other. So what should be done to assure Ontarians that all vaccines, I know this is something that your government has been trying to assure, but what should be done to assure Ontarians that no matter what vaccine you have, it is a safe vaccine?
Well, all of the vaccines that have been approved for use in Canada, the AstraZeneca, the Moderna, and the Pfizer, have all been approved medically by people who are knowledgeable in these matters, so they're all safe. What we do say is that the best vaccine for you is the one that's available for you today, because getting vaccinated sooner rather than later is the best for everyone, including the individual that's receiving it. But they're all safe, they're all healthy, they will provide significant protection. No one vaccine can prevent you 100% from getting COVID, but they provide very good protection. And even if someone does get COVID after the first injection, sometimes after the second, it's generally a much milder case that does not usually require hospitalization. So it's a good idea to get the vaccine for your protection, your families, and your community.
And I'm gonna ask you too about many opposition parties are asking about paid sick days or rather additional paid sick day measures, or let's say a cap on class sizes. I know a lot of those things aren't in your ministry, but is this something that your government will consider further if it is proven to reduce the spread of COVID?
Well, we already have taken steps to include sick days because we want to make sure that people will be able to stay home if they show symptoms of COVID until they receive their test results. And we want to make sure that even some people have I wouldn't call them bad reactions, but they don't feel very well for a few days after they have the COVID vaccine. We want to make sure that people can take time off if they need to recover from the vaccines. So we are doing that. We aren't capping class sizes per se, although we are taking really significant steps in our schools to make sure that they're safe for everyone. In elementary school, you probably already know that students will be cohorted. In high school, they will be taking just 2 classes per semester so that if any steps need to be taken to limit classes, we will be able to do that. They've also spent millions of dollars in cleaning and on improving air quality and ventilation across the schools. We want schools to be safe places for students to go so that you'll have an opportunity to learn, but also to be safe physically and not get COVID.
Okay, and so today we saw 325 additional cases of COVID. Yesterday we saw 423. So is there a threshold that COVID cases will have to hit, or has the chief medical officer told you or told Ontarians anything about a certain threshold we would have to hit before we would have to enter lockdown again? I know Dr. David Williams, the previous medical officer of health, would sometimes set thresholds for, let's say, when we would be able to open again or if we would have to lock down again. So are there any thresholds that Ontarians should know as opposed to if we would have to enter another lockdown again? Because I think right now it's hard for a lot of Ontarians to think about if another lockdown were to take place, they could have to risk losing their job again, or they would have to maybe fear about losing their business again. Because I think COVID's just been really hard on business owners and workers in general.
Well, I would certainly agree with you, Wyatt. It has been very difficult for, I think, everyone in Ontario, but particularly for business owners or people who've lost their jobs. This has been really, really hard financially for them, and it's also affected a lot of people's mental health too. So that's why we're doing everything that we can to prevent a fourth wave, but no thresholds have been established as yet. The increase in cases that we've seen over the last week or so, we did expect to see because it's just been 3 weeks since we've moved into stage 3. And so we knew with the opening up of Ontario, there would be more cases, but our levels in our intensive care units are entirely manageable. And we're watching every day, but we are, as I said, taking every step that we can to not have a fourth wave. And if we did need to consider a threshold in the future, we would look at a variety of issues. The numbers of the case counts, of course, are going to be really important, but also the ability of our healthcare system to manage large increases where people would go in hospitals, the number of people in intensive care, the number of people on ventilators. So there's a whole number of metrics that we would need to take a look at. But fortunately, we are not anywhere near that stage, and we are working very hard to keep the numbers as low as possible.
And if COVID cases were to rise further, and another lockdown is something that would have to happen and would become somewhat of a reality, would people who are vaccinated, I guess you could say, maybe have more freedom than people who aren't vaccinated if another lockdown were to happen?
Well, right now, we don't have provincially a policy about vaccinations. We are leaving it up to people to be vaccinated. It's their own determination whether they choose to do that, although we are really encouraging people to be vaccinated. But some employers, some businesses are already saying that they want everyone that works for them to be vaccinated. That's really up to the individual business to take that step. That's not really up to the government of Ontario to say that. And so that's really, I guess it would be up to businesses if we were forced to move into more of a lockdown, or what businesses would choose to do. We would have some overall guidelines, but then they would choose within those guidelines what steps they prefer to take.
If because I think right now there's many regions whose cases might be going up, but other regions whose cases might be going down. So, is there an what in the regions where cases are going down? Is there an opportunity for them to, I guess you could say, stage four maybe would come into effect? And can you just explain what it will look like following stage three?
Well, at the end of stage three, that's it for stages. Then we just go back into normal procedures, whatever the new normal is. And so that would be a time when all of the province would be released. What we found earlier was when we allowed some regions to move further ahead than others, whether they had low or high case counts. People then tended to go to those regions that had more open facilities, and then they found out that they had higher levels of infection. So that's why we're looking at it really across the province to make that determination as to when we remove any restrictions whatsoever, and that would be at the end of stage three and the beginning of the new normal. So we're being very cautious, very careful, because we know that some other countries have maybe opened up a little too quickly, and they've ended up with having to go back into lockdown again. And I think Ontarians have seen enough of lockdowns. We don't want to turn back. We want to keep moving forward. And so that's why some people might say we're being too cautious. But on the other hand, being cautious means being safe and means being able to reopen. And I think that's what Ontarians are looking for.
All right, Christine. Well, that was my final question for you today. So thanks for joining me, and it's been good talking with you.
Thank you very much, Wyatt. It's been a great pleasure speaking with you as well. Thank you.
All right, bye now.
Bye.